Alrighty. Well, thank you, Yuli, for having us tonight. Certainly excited about the opportunity to talk to you all and share what we're doing and to hear some of your questions and hopefully some feedback. Hopefully you find it interesting as well. I typically like to start these talks to give a little bit of context around our view of kind of where healthcare is heading and how we fit into that. I certainly think we would probably agree that the change that's taking place is very, very rapid. And for the most part, I think a lot of that change is very, very positive. Care it's becoming much more patient-centric. It is much more working towards keeping people in their home when we can do that. And it's all in all, people are more connected with their providers, connected with the health system, and that, as I said, is a very, very good thing. Unfortunately, I think from our perspective, there's a segment of the population that is a little bit left behind and kind of still kept in what we'd kind of call more that old world of care. And that's really folks with chronic conditions. And the reason why is there's just not great line of sight in terms of what's happening with their conditions. The reality is these folks' conditions are changing, oftentimes on a rapid basis, and unless you have connectivity with these people, it's very, very difficult to know what's happening, when it's happening. And the result is, they are in a world still that's very episodic. You're very much reactive to what's happened to them, and it's very, very costly. It's costly in economic terms, and it's costly in psychological terms for the individual if you're having to go to the ER and in the hospital. It's not a good world to be living in. And that's the piece that we at Spry Health really feel that we help solve. We help bring this population into a world because of what we do. And by being able to provide continuous and passive monitoring, you can now get this line of sight to these individuals and understanding what's happening with their condition, and then be able to intervene at the right time where they're not stuck in this reactive world. So it's a piece, again, that we feel that we bring something new to the table. And the way that we do it is two different pieces up here. We actually have a device. It is pre-FDA, so we're actually going to be submitting here next month for approval, and I'll talk a little bit about that. But it's a device I'm wearing right here on my wrist, if you can see. It's called the Loop, and it monitors a variety of different vital signs. So it measures your blood pressure, respiration rate, pulse oximetry, and heart rate, as well as activity. And that data is sent through the cloud to our analytics engine, and that really provides the ability for health systems, for providers, whoever's responsible for the care of these individuals, it gives them the ability to understand who they need to be reaching out to and when to be able to provide this kind of connective, patient-centric, preventative type of care. And this is something that is unique. I think there's a lot of remote monitoring that people have tried to do, but the challenge in the past has been, when people get sent home with a box full of blood pressure cuffs and pulse oximeters, it doesn't work well. It's intrusive on people's lives, and it puts a burden on them to have to do this. So, as I mentioned, we are pre-FDA, but we have completed 2 different clinical trials. One up here at UCSF in their hypoxia lab. And the results were very, very good around the pulse oximetry. And then we had a study that we've just completed down at Huntington Hospital in Southern California, where we had 235 patients who were undergoing surgery. And while they were undergoing surgery, they were wearing our device, so they were being monitored, their blood pressure that way. So all this information is being, as I said, packaged up, and we're excited to be submitting here next month. The other piece people often ask about, well, how is this data transmitted to the providers? So there's a couple different ways that can happen. What we've focused on, first was trying to create something that lowered the barriers for people actually wearing the device and actually getting the data there. And as someone mentioned earlier in a talk, the reality is a lot of seniors who have these chronic conditions, oftentimes it's low-income people, they don't necessarily have smartphones. They don't necessarily know how to connect apps to different things. So we have a charging station, and we try to create routines with the patients where they would wake up, they'd put the device on, they'd wear it throughout the day, and then at night they plug in the device. In the charging station is a cellular chip, and the data is transmitted once a day, into the cloud to our portal. The other ways we also do have, if they do happen to have a device, Bluetooth connectivity or tablet, we can actually connect it there, and there's, I think, an interesting telemedicine type usage where if you're a doctor and you have a patient who's, you've gotten an alert on, the ability to call them up and interact with them and be able to see their vitals while they're in their home and you're in their office, we think it's something that can be very, very powerful as well. So, just have a few use cases. First, I was just going to show you, this is just our portal. And the other thing I'll point out as well is we do have this. We certainly realize that a lot of the health systems, the reality is they already have their own system. So we can integrate with other systems as well, as needed. But we've come up with a color coding system. So reds would be the ones that have alerts where you would need to reach out to. Yellow is trending in that direction, and then greens are the one that are in a stable position. And there's kind of we call it almost an operational use case, because for folks who are doing remote monitoring today, the reality is they don't know who to reach out to. It's often based upon just their risk factors or those things, and that may or may not be accurate in terms of who they should be talking to. A couple other just examples here. Here's a COPD patient. We'll kind of talk about in terms of the time lapse on the bottom. If you get to that end state there, the reality is it's too late. You've reached a point where you're going to have to be in the ER or the hospital. So what we're trying to point out here is that that we're, by monitoring on a continuous basis, actually have the ability to detect things that are starting to change, so you can reach out to people days and days in advance of that happening, again, to keep them in the home. Or sometimes we talk about trying to deliver the most effective care in a lower cost setting. So maybe they have to come in to your clinic or whatever it might be, but that's still more advantageous than having to go to the hospital itself. So there's a variety of use cases. The different vitals are often the different indicators. Here's a CHF example, hypertension, perhaps where someone isn't taking their meds, where you can see there's certain spikes that are taking place. And then the last thing I'll point out, and then we can open up for questions. We also think this can be interesting from a population health perspective. So today, this type of data is really only gathered when someone's in the hospital. So to be able to get this breadth of data across these different vitals, on a continuous basis, and then to be able to track these individuals, we think that the power from a predictive perspective can be pretty amazing and really be a very, very positive change in the world of healthcare. And certainly help us understand disease states and what's going on from a physiological perspective within people. So that was a presentation. I'm happy to answer any questions that folks might have.
How accurate is your blood pressure readings from this monitor?
Yeah, so again, we've just completed our study. Oh, yes. The question was the accuracy of the blood pressure with the device. That's oftentimes the first question people ask, because certainly no one else has been able to do this. We're very, very confident in terms of the prospects of getting FDA approval. Obviously, we need to go through that process, but the results that we've seen out of our trial look very, 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 very promising. Yes?
Two questions. What's the battery life?
Mm-hmm.
And what's the time granularity of the different data points?
Yeah, so the way is the battery can last for, right now, about 24 hours. So that's why we actually have, again, we're trying to create a pattern where people use it through the day and then plug it in at night, and then they just never have to worry about the battery itself running out. Your second question was, I'm sorry?
Time granularity.
Oh, time granularity. So the way that the measured, it's probably a more accurate way to say it would be semi-continuous. We measure for about 7.5 minutes out of every 30 minutes in terms of the measurements that are taking place. That can actually be adjusted for how you want to do it. It's about, again, 15 minutes over every hour.
And is the granularity different for the different sensor types?
For the different vitals?
Yeah.
In terms of, no. It's all basically time-stamped at the same time. Any other questions? Yes?
What's the mechanism of measuring blood pressure?
Yeah, that It's a little bit technical. We have some very, very smart people who have done that, but it's a combination of there are optics that are in the thing and the way that they're placed. It's measuring actually the pulse wave velocity of the blood moving through the radial artery there. And they're actually looking at the elasticity of the artery itself, and those changes are what allow us to do it.
Have you considered using that as an inpatient monitoring device rather than an outpatient monitoring device?
There certainly has been interest in a variety of different use cases. I guess part of it as a new company, right, is the focus. We think kind of the biggest impact we can have is on more of an outpatient setting where it's, that type of monitoring is not available. Certainly, it would be more economical to do something like this than some of the devices they have to use in an inpatient setting. Was there another question? No?
I was just going to ask, so if someone was, let's say, having sleep apnea or something like that, I mean, if what would be the duty cycle that you would offer with respect to doing something in that area?
With sleep apnea?
Yeah, so you're obviously monitoring vitals while people are asleep.
Yep.
So potentially important.
Yeah, there has been interest in that in terms of doing. Certainly, sleep apnea is another thing, and there's. Again, I'm not a doctor myself, but from my understanding is there's lots of things in terms of that happen during the nighttime that people don't necessarily understand what's happening with the body, and there's a lot of interest in that, whether sleep apnea, nocturnal hypertension is another area where we've had a lot of interest in potentially working with our device to really understand what's happening with the body during nighttime as it relates to these specific conditions.